Hi everybody, welcome back to some more, I guess you would call it Dr. Drae. That's what we've been calling it lately, and it oddly suits. Today we're doing carpal tunnel surgery, or release. I guess you go into that part of the hand and do some gross stuff to release some of the pain of carpal tunnel. So yeah, let's get right into it and see what's his name? Oh my god, I haven't played this in like 2 weeks. So I'm kind of excited.
Welcome to SurgerySquad's
That
virtual
guy.
limited open carpal tunnel release surgery. I'm Dr. Jeff.
Dr.
And I will be
Jeff.
guiding you through the procedure
Welcome back,
today.
Dr. Jeff.
Carpal
it
tunnel
was Dr.
syndrome
Susie
is
that we've seen for a
characterized
while.
by a tingling numbness or pain in your hand, and sometimes forearm. It develops due to the swelling of a ligament in the wrist known as the transverse carpal ligament. The swelling of the transverse carpal ligament creates pressure on the median nerve in your wrist. This nerve is responsible for supplying feeling and movement to various parts of the hand. Performing repetitive motions with the hand or wrist over a long period is the main cause of carpal tunnel syndrome, and the condition is more commonly seen in women than men. Researchers have also discovered that other medical problems such as alcoholism,
I feel like I'm in
arthritis, diabetes, obesity, and infections could also lead to carpal tunnel syndrome.
I think that just
Today
leads
we'll be
to playing on the
operating
computer
a patient
too
who
much.
has been diagnosed with carpal tunnel syndrome after experiencing numbness and weakness in the palm of his hand and thumb. Now let's put on our gloves and get started.
All right.
The
Let's do it,
limited
Dr.
open
Jeff.
carpal tunnel release
I think you should do it,
surgery
not
is
me,
performed
but-
using a local anesthetic that numbs the carpal tunnel area of the hand and wrist. If
Okay.
a patient is nervous or uncomfortable, I'll sometimes use a sedative as well.
All
A
you do is
sedative
numb it?
is a
That's
drug
crazy.
given
You're
through
going
an
in
IV
there.
that places the patient in a dreamlike state. However, our patient today will only
need to be
receive
placed
the
in one of
local
those.
anesthetic. Go ahead and get the operating area numb.
Okay, so that's all we're doing is numbing it. So it's basically like getting a filling in dentistry. So there you go. Numb that baby up, because we're going to go in there and fix you up. There we go.
With the wrist anesthetized, we can now begin the operation.
Okay.
I've already tied a tournament around the patient's upper
I
arm.
can see his hand just
Can
actually
you go ahead
changed
and
color.
outline
It's like
where we'll be
dying.
making our incision?
Yes. We're going to make it right here. Gonna cut off his fingers. There we go.
Looks good
Oh,
to me.
thanks.
We'll be
Yeah,
making
I
a
love how he does
3/4
it for
inch
me
incision
anyways.
At the intersection of those lines. Now take the scalpel
What's up
and
with-
make the incision.
Why do we need the other line? What's up? What is the point of this long line? I don't. Okay, let's do that. All right,
Nice.
that's not too
I
bad.
couldn't have done it better myself.
Thanks. I cut some
Now
skin.
we'll spread
Big deal.
the incision wider
No,
to
don't spread it.
expose the
That's
transverse
one of
carpal
screw.
ligament.
Okay.
This band of tissue is the cause of the problems. Place the retractors into the
The
incision and
retractors
spread it
is
open.
actually a name. Come on, is it gonna do it quick? Just slowly do it, please.
I
Oh,
think you're a natural at this.
no, I'm not. Okay, what are you doing with it? What is moving now?
With the transverse carpal ligament exposed,
That-
I'll need
what?
you to slip a carpal tunnel guide into the incision.
I don't.
This is a blunt-tipped instrument with a groove on the upper surface to accommodate a special knife.
Oh no.
The carpal
Ooh.
tunnel guide is
Ooh, icky.
placed down the carpal tunnel and underneath the
What?
ligament and is used to protect the underlying nerve and tendons.
Okay.
Go ahead and push the carpal tunnel
No.
guide into place.
No. No. Okay. What? I don't even understand what he was just talking. You're talking too fast, Dr. Jeff. I'm just trying to not be. Oh, it's. Why? Ooh.
Once it's in position,
Okay.
you'll advance our special knife
like,
down
look,
the
it's right
guide
there.
to split the carpal ligament.
Okay.
As you push the knife forward,
No.
you will feel it cutting through the carpal ligament.
Yeah. So you're just getting rid of it. That's all you're doing. You're cutting it off. Okay, here we go. Gonna cut it off. Big deal. No big deal. There you go. There you go. It's all safe
Perfect.
now, right? That's it, right? Oh my
With
god.
the transverse carpal ligament cut, the median nerve is no longer inflamed. Now we can begin to clean and close the
Isn't
incision.
that thing important? Like
Go
why?
ahead and
We
irrigate
just got
the
rid of
wound.
it. What aerate? Oh, irrigate the wound. Okay.
When you're finished, I'll release the tourniquet,
Oh,
allowing
okay.
blood to flow back into the hand.
The
Great.
What did you
now
say?
you'll close the wound
Oh my God,
using
you're going too quick.
non-absorbable sutures.
Okay, so you just want me to stitch it up? I can do that. That's not too bad. Man. I can...
With the wound closed, we'll inject
So they just
additional
cut
numbing
off the-
medicine
the-
around the
whatever that
operating
thing
site
was.
to help relieve some of the immediate pain the patient may feel
Yeah, no
after surgery.
shit. Like, seriously, you just cut him up. That's all you did was cut something. It's like, oh, we don't need that anymore. It's causing pain. Let's get rid of it.
And lastly, we'll place a small dressing over the wound to absorb any residual blood.
Okay. This is nice. This is the kind of stuff that I can do. There you go.
We'll immobilize the
thing.
wrist with a splint and a
Okay.
sling, and after 1 to 3 hours, our patient is sent home to recover.
All
Our
right.
patient needs to keep in mind that because of some of the medications we used, he may experience a bit of nausea. He will also
You don't
be
say.
given pain medication
I just
to
experienced
help
a bit.
relieve the discomfort he'll feel in his wrist. Once our patient returns home, he'll be asked to follow specific instructions for driving, exercise, and medication. This will include keeping his hand elevated above his heart for the first few days after surgery.
Wow.
About 2 weeks
Ugh.
after surgery,
Oh, no, not
we'll
real.
remove our patient's
Oh, his
stitches,
hand's all, like,
and he'll be
bruised. What
gradually allowed to return to his
Okay.
normal routines
Oh.
in 4 to 6
It's
weeks.
just a weird part to go into.
And
Like,
that's
why
a
don't you go in
limited
up
open
there or
carpal
something,
tunnel
not
release surgery.
on your palm of
Thanks
your
for
hand?
stopping
That
by.
hits a lot of things.
Why not try out some of
No,
the other amazing
stop.
surgeries?
Why do you always
here
tell
on
me this?
SurgerySquad.com?
Gallbladder surgery. I guess we'll do that next. I don't know what that entails, but yes. Okay, so that was another episode of Dr. Drae. Today we did some carpal tunnel surgery. Thanks for watching. I'll see you in the next one.